not to make you think that we can prevent COVID, but we can certainly prevent our risk of developing severe complications from COVID, which are often mediated by lifestyle-driven diseases. So I'm going to start by telling you a little bit about some of the programs that we're offering at 3 done in conjunction with the cardiology division at Newton-Wellesley. So I want to tell you a little bit about our whole health lifestyle medicine program, which we deliver either on an individual basis. So for example, you can send a patient for a consult with us where we dive through the 6 pillars of lifestyle medicine with them, and we continue to follow them for about 5 or 6 sessions, and then they graduate. Or they can participate in our group sessions, which we hope to launch in the very near future using Zoom, as doing group visits via Zoom. This is a brochure that's available to you to send to your patients that sort of gives them some information about the program. This is an insurance-based program, so they do need to have a diagnosis to be entered, and they can call us to be enrolled. So where are we located? So we're the newest location of Newton-Wellesley Hospital. We are located in the old Atrium Mall, now known as the Lifestyle Building. And ironically, we are right where the prior Cheesecake Factory used to be located. And we do offer a number of types of consultation, lifestyle medicine, integrative cardiology. We also provide internal medicine. And we do have, and I'm not going to focus on that today, but we do offer a comprehensive membership program for those people who want also primary care. So first, before I introduce our team, I just want to talk about what lifestyle medicine is. Lifestyle medicine is the evidence-based practice of helping individuals and families adopt and sustain healthy behaviors that affect health and quality of life. And the values that surround lifestyle medicine is that lifestyle practices and health habits are among the nation's most important health determinants, and that changing unhealthy behaviors is foundational to medical care, disease prevention, and health promotion. And of course, it's perhaps one of the most challenging things that we do on a day-to-day basis. So here's our team. It's growing, and I'll start sort of from the top. So Diane Lynch is our
I think it's, yeah,
specialist, and Caitlin Peters is our nurse practitioner. She delivers a lot of the lifestyle medicine one-on-one visits. She's certified in lifestyle medicine through the ACLM, and she's also a certified health coach in addition to being a nurse practitioner. Daniel Rodman is our meditation instructor, and we do offer free meditation sessions via Zoom, and we do this every other week, every other Monday. We've been doing that throughout the pandemic. All are invited, and it's free to all. Laura Klein is one of our guest chefs. She's also a certified health coach, and she helps with Caitlin and I. We teach our monthly cooking classes with Laura. Of course, there's me, and I'm really excited to announce a new member of our team, Dr. Janine Pardo. She's been a member of the Newton-Wellesley community in the past, and she's going to be joining me full-time starting in November. And of course, George Philippides, with whom we collaborate and deliver a really comprehensive integrative approach to care. And George, I believe you're on the line, so if you're there and you're able to unmute, I'd welcome you to make a comment or two.
So I'll be brief. We in Newton-Wellesley Cardiology are really thrilled to have Dr. Parks and her team be joining us in this great collaboration. And really, preventive cardiology is now considered to be almost an old term, an old way of looking at the greater issue of lifestyle and the impact on cardiovascular health. So this is really taking that element of Newton-Wellesley Hospital to the very highest level, as you'll see. So we're really excited about this new program. I did want to mention that when you try to refer via Epic, we had redone the Epic screen a while ago, but it is still not exactly as it should be. But if you just specify, thanks for that lead in, lifestyle medicine consult, we will get you to the appropriate place, which is Dr. Park's program. There still is a preventive cardiology lipid management option. That is specifically for people where there are questions of should they be on medications, statin intolerance, need for PCSK9 inhibitors. and also for the possibility of getting a coronary artery calcium score. That's specifically that clinic, which I actually quarterback. But if you want what you're about to hear about, just type in lifestyle medicine. We will be fixing the screen soon and getting that out to you, but that's how to get to Dr. Parks and her great team in the meantime. So thanks, Kim.
Thank you, George. And it's such a pleasure to work with you and your team. And so this button actually gets you, you have to go to ambulatory referral to Newton-Wellesley cardiology to get to our program. So again, just Newton-Wellesley cardiology, and then you can, at this point, either hit Synergy Private Health or Newton-Wellesley Physicians, and if you place lifestyle medicine consult, it'll get to us. And certainly you're always welcome to send me a direct email or message through Epic, and we'll be happy to get your patient scheduled. So patients to think about in terms of when you're thinking about who you might referral, I mean, really anybody with any risk factors for cardiovascular disease. So dyslipidemia, known coronary disease, hypertension, diabetes, metabolic syndrome, AFib, obesity. Both Caitlin and I have completed the Blackburn obesity course, and I plan to get certified in obesity medicine in the future, just to sort of round that out. So now I'm going to move on, talk a little bit about lifestyle medicine and the principles of lifestyle medicine. And this is an infographic that comes from the ACLM, American College of Lifestyle Medicine. I encourage you to explore their website if you're not already familiar with them. But lifestyle medicine focuses on 6 pillars of health. And it starts with, well, all things contribute equally. Healthful eating, physical activity, how are we managing stress? How are we managing relationships? What is your sleep like? Are you exposed to toxins like tobacco or excess alcohol? And, as a cardiologist, our colleagues at Mass General have done data showing what happens to coronary blood flow when a person is under stress. And coronary blood flow is significantly altered when a person is under stress. So if I am prescribing a statin for you, and I haven't spoken to you about, how you're managing your stress, I haven't done a full job in providing a whole health approach to your care. If we're talking about AFib, it's the same thing. Do you have sleep apnea, et cetera, et cetera. So these 6 pillars apply really to pretty much any chronic disease in both treatment and prevention. So, we are sicker than we need to be as a nation, right? 70% of cardiovascular disease can be prevented or delayed with dietary choices and lifestyle modifications. And in fact, it's not just here in the US. Globally, 60 to 70% of diseases are lifestyle related. And one of my interests is certainly the dietary components. This is some data looking at the number of deaths related to the 17 leading risk factors in the US that are modifiable. And if you look at the top line here, what you can see is dietary risk leads the pack. I mean, above tobacco use, above high blood pressure, above high body mass index. The standard American diet is bringing people to an early death. And if you notice this blue line here, that represents cardiovascular disease. And so you can see that suboptimal diet is the #1 risk factor for premature death, but specifically cardiovascular disease. And the SAD state, that's the standard American diet state of our health, tells us that poor diet is the leading cause of death and disability with 700,000 deaths per year. And suboptimal diet is associated with many chronic diseases, not just cardiovascular disease, but also obesity, diabetes, and certain cancers. And nearly 50% of deaths related to cardiovascular disease, stroke, and diabetes are related to poor diet. Now, here is a study that looked at 100,000 individuals and looked at their habits, and they found that if you followed these 5 healthy habits, eating a healthy diet, exercising regularly, keeping a healthy BMI, not drinking too much, and not smoking, you had a 65% lower risk of dying from cancer and a 74% lower risk of dying prematurely from all causes. And in fact, if you adhere to all 5 lifestyle habits, you can live an average of 12 to 14 years longer. And so if you put that in the context of medications that we commonly prescribe for patients to reduce mortality, these numbers far surpass, for example, the way that a statin might reduce your risk of death. Now, how many people are actually living a healthy lifestyle? Well, here's a study that came out of the Mayo Clinic proceedings that looked at just 4 of those 5 habits that I mentioned, and only 2.7% actually admitted to following all 4 of these: not smoking, eating a diet that aligns with nutritional guidelines, exercising, and keeping their BMI below 20% for men and 30% for women. So now let's move on to how lifestyle medicine fits into COVID. And this picture is really like probably the classic photo. This is what I kind of imagine that many of our patients, or even ourselves, are doing at home now. I mean, you know, the only thing missing here is a computer with a Zoom screen. But you know, these days, nobody's getting up to go walk across the room to talk to a colleague or go to a meeting. But you can see here, I mean, my blood pressure is going up a little bit looking at all the sodium on that plate with the hot dog, the processed foods. The only vegetable you see is a little slice of lettuce there, maybe a tomato, and he's got not just alcohol, but that's a pretty large thing he's got there in his hand. And he doesn't even have to get out of his seat to turn on the TV or turn it off or change channel, because he's got the remote right there. So we can all identify with this either ourselves or in our patients. So lifestyle-related diseases are prominent. It's a prominent risk factor for being hospitalized and also for mortality. And here are some data that came from MMWR that looked at patients in 99 counties and 14 states. And you can see that it varies among age in terms of underlying conditions that were found in hospitalized patients. But you can see that the younger you are, the more likely obesity is going to be your problem. The older you are, the more likely hypertension and cardiovascular disease is going to be a problem. And the question then I ask is, well, what's the prevalence of cardiovascular disease in that population anyway? I mean, 52% of people over age 65 have cardiovascular disease, et cetera, et cetera. Well, as it turns out, it is statistically significant, the difference here, particularly as it pertains to diabetes. Here is a study from the CDC that found that hospitalizations were 6 times higher and deaths 12 times higher for COVID-19 patients with underlying conditions, with the most frequently reported conditions being cardiovascular disease, diabetes, and chronic lung disease. And all this data is parsed out on the CDC.gov if you're interested. So certainly there, from a public health perspective and from a cost perspective, this should really perk up the ears of administrators and people who are looking at finances to keep costs down. We should be, in my mind, really pouring money into how do we educate people. And I think of it not just in our adults, but we really have to start early, with our children and helping to educate families, not just adults. And here is data many of you probably have seen. This is the characteristics among 5,700 patients in the New York City area. This is from the Northwell data. And the most common comorbidities in this cohort was number 1, hypertension, number 2, obesity, and 3rd was diabetes. And these people, generally the mean age was 63 years. So now let's see how each of these pillars relate to COVID as we think about lifestyle medicine. Nutrition, what's happening? How are people eating in the face of COVID? And in this International Food Information Council survey, 85% of patients, or participants rather, reported a change in their dietary intake. And one thing that I was happy to see is that more people are cooking at home. That's what we do in my practice. We teach people to cook at home because we know it actually can improve the quality of what we eat. But as it turns out, there's a lot of other stuff happening. People are snacking more, they're eating, they're potentially eating more, et cetera. So there's been some mixed work where I'm working with a group from the chef coaching group at the Institute of Lifestyle Medicine, and some of our data is finding that there's like a 50-50 split. That some people have actually used this opportunity to be healthier and learn some better, healthier cooking skills, and others are just they're stress eating. How about movement, physical activity? Are people moving more? They have an opportunity perhaps to focus more on exercise. The study looked at patient trackers within cell phones, etc. And I'm going to just point you to the direction of U.S. cities, and this is mean daily steps, starting February, March, and you can see as a whole, we are not moving as more, despite having maybe a little bit more time to actually exercise, dropped significantly in the U.S. And it's kind of all over the map worldwide, but you see the trend is that decrease in steps. This shows absolute steps, and this is a change from baseline. So people are not moving as they used to. And both of these things, eating poorly, moving less, can lead to obesity. And one thing I've learned in my recent training in obesity medicine is that fat cells are biologically active. They are inflammatory. And the more you have, the more inflammatory they become. And so when a person has overweight or obesity, and particularly if you have obesity with metabolic dysfunction, you can see you have all these pro-inflammatory adipokines that are just, waiting around, and these fat cells get stimulated, and you get perhaps a more profound cytokine response to COVID-19. That's the hypothesis. Well, this is probably no surprise. This is some data showing alcoholic beverage sales increasing significantly. This is the increase during COVID in in-person stores. This is a Nielsen study. So beer, wine, spirits, everything goes up. But look at this online. Online alcoholic beverage sales went up 477%. Smoking. People are smoking more. And you can see smoking also increases your risk of more severe disease. And this is a list of various studies that looked at smoking's impact on severity of COVID. And there were, a couple of articles that were sensationalized in the media that showed, gee, if you smoked, you were protected against more severe COVID. But the majority of the studies are showing pretty significant increase in disease progression if you're smoking, sometimes as much as 5 to 10 times more than a non-smoker. Stress levels. This is an interesting study that looked at cortisol levels, which are associated with stress levels. When the baseline cortisol levels when people entered the hospital, and found that people that had higher baseline cortisol levels actually had a higher rate of morbidity and mortality related to COVID-19. So certainly there's data to suggest that perhaps, doing mindfulness activities or figuring out ways for people to reduce stress can also protect them against severity of disease. Anyone having trouble sleep? Your patients complaining about COVID-somnia? This is a real thing, and we all know how important sleep is in managing chronic diseases. How about social isolation? I mean, that's one of the key pillars to health, is how are people socializing? How are their relationships? And something to be aware of. The pandemic of isolation has grown and nearly doubled during this pandemic, and it's a reminder to us as physicians to talk to our patients about socializing. And just because we have to be 6 feet apart doesn't mean social distancing and social isolating should not be one and the same. And it's an important aspect of our overall health. And people are getting sicker when they're at home. Their health habits seem to be on the decline based on the data that I just showed. But when people are having regular disease, they're coming in sicker and they're doing worse. So this is a study that looked at 15,000 hospitalizations with patients and 14,000 patients with MI, and we saw a decrease in rates. But what we found is that the outcomes that were occurring in patients who were presenting with MI were actually worse. So now I'll transition on what we're doing, what you can suggest your patients do. We try to give our patients as many tools as we can to help manage those 6 pillars. We're very aggressive about sending them for CBTI, for sleep training if we need to. We try to work with them on stress management techniques, refer them to therapists if we need to, but we also teach them things that they can do on their own. We love the use of apps as well, so I'm always giving patients lists of apps that they can use. But we do this Mindful Monday that we would ordinarily do in our office, but we're offering it free to all every other Monday at 1 p.m. It's only 20 minutes, led by our meditation instructor. And then the other thing that we're doing, again, we talked about food as a risk factor. We do our plant-based cooking classes once a month. We do it the 3rd Tuesday of the month by Zoom. We send out a list of items that patients need to participate so they can be prepared in advance, and we do hands-on cooking together. It's really a lot of fun. And here's a photo of one of those Zoom meetings. This is actually for Dr. Amy Commander's paving group that we hosted with her participants. And then there's Dr. Uma Naidu, who's a nutritional psychiatrist and also a trained chef. She was our guest chef for the evening. Caitlin Peters, our nurse practitioner, and there I am, and this is one of the participants in the program. It's great. They send us their photos. There's great discussion. It's really a great way to increase socialization. So you're really working on 2 of the pillars: good nutrition and good socialization. Some people stress well. So lastly, in summary, lifestyle medicine is really a powerful therapy for prevention, control, and even potentially reversal and remission of now well-established risk factors for COVID-associated morbidity and mortality. And if you want to participate in some of the events that I just showed you, you can sign up for our newsletter or go on our website, and we have a calendar of events. And I believe that it goes out once a month. There is an invite in one of the Newton-Wellesley announcements. And at that, I will begin taking questions.
Thanks, Kim, very much. That's great. I don't know if you can see the chat box. I'll read the first question. Is there a current collaboration with the Newton-Wellesley Hospital Bariatric Center for the significantly obese patients with or without comorbidities who have not had success despite many attempts at lifestyle measures?
We don't have a formal relationship, but certainly, I have spoken with Dr. Partridge a number of times. We've passed patients back and forth, and that's certainly an opportunity for us in the future that we have discussed.
And George wrote
can I jump in?
Go ahead. Thanks, George. Go ahead.
So we at Newton-Wellesley Hospital, I think you'll all agree, have been trying to man the outfield with a left fielder, which is bariatric surgery, and a right fielder, which is cardiovascular medicine and primary care. And all these balls keep dropping in center field. What the hospital needs, in our opinion, is a medical obesity specialist to have a medical obesity program for the pharmacotherapy and for the shepherding between the different divisions. And you'll be happy to know that we're in the process of recruiting such a person to resurrect that medical obesity program, hopefully within the next few months, in collaboration with the Mass General Hospital. So Jean Stepnell-Resnick, Dr. Partridge and I have interviewed several candidates, and it looks like we're close to bringing somebody on. When that happens, they will be out to meet many of you guys, many of the leaders in primary care and family medicine, Kim and others, and we'll figure out a way to sort of make this collaborative and coordinated and to make it work. So right now, the relationship is really, I think, awkward and not well thought out, but it's going to get better.
Thanks, George. Any other questions or comments for Dr. Parks or Dr. Philippides? What happened to the Dean Ornish program at MG, probably H, I think that is. Does anyone know? Do you know, George or Kim?
I have no idea.
Yeah, I don't think they don't have an official Dean Ornish program. Dean Ornish has a specific protocol, which actually is reimbursable by Medicare if you follow their his program specifically. MGH has a similar program. It's not it's based,
all those things.
But there is a similar program at MGH. It's not the Ornish program.
Okay, well, with that, I'm gonna end today's session. The session has been recorded. I put the CME code in the box. Thank you again, Kim, for coming on and enlightening us. And we will see you next week. I don't have the teaser for next week. We'll get that out though. Again, we're here every Thursday, 12:30 to 1. Bring your lunch, tell your friends, and go ahead and get the CME for it. Thanks again. Bye.